Introduction. Welcome, students, to today's lecture on the fascinating field of endocrinology. In this comprehensive script, we will delve into the intricate world of pituitary physiology, growth hormone deficiency, indications for growth hormone therapy, protocols for administration, monitoring treatment response, long-term outcomes and safety concerns, and many other essential topics. So, let's begin our journey into the realm of endocrinology. The pituitary gland is a small, pea-sized structure located at the base of the brain. It plays a crucial role in the intricate symphony of hormone regulation within our bodies. The gland is divided into two main parts, the anterior pituitary and the posterior pituitary. The anterior pituitary produces and releases several important hormones, including growth hormone, GH, adrenocorticotropic hormone, ACTH, thyroid-stimulating hormone, TSH, gonadotropins, FSH and LH, and prolactin. These hormones are regulated by a variety of factors, such as hypothalamic releasing and inhibiting hormones, feedback loops, and other systemic influences. Growth hormone deficiency, GHD, refers to a condition in which the pituitary gland fails to produce adequate amounts of growth hormone. It can be categorized into congenital or acquired forms, each with their own unique etiologies. Congenital GHD may result from genetic mutations affecting the production or function of growth hormone, pituitary development abnormalities, or hypothalamic pituitary structural defects. On the other hand, acquired GHD can be caused by tumors, trauma, radiation therapy, infections, or certain medical conditions like infiltrative disorders or autoimmune diseases. Determining the need for growth hormone therapy involves a comprehensive assessment, including clinical evaluation, growth monitoring, genetic testing, hormonal evaluations, and radiological assessments. Indications for growth hormone therapy may include severe growth hormone deficiency, certain genetic syndromes associated with growth failure, chronic renal insufficiency, Turner syndrome, idiopathic short stature, and Prader-Willi syndrome. The decision to initiate growth hormone therapy should also consider the potential benefits and risks, patient's age, bone age, growth potential, and overall treatment goals. Growth hormone therapy involves the administration of exogenous growth hormone to achieve optimal growth and development in individuals with growth hormone deficiency. Several protocols exist for GH therapy, including daily subcutaneous injections and weekly doses. The dosage is carefully calculated based on the patient's weight, age, and individual needs. The administration route, dosage, and frequency may vary depending on the underlying condition and treatment goals. Monitoring and adjusting the dose during therapy play a crucial role in achieving optimal treatment outcomes. Regular monitoring of growth parameters, including height, weight, and body composition, is essential to evaluate the response to growth hormone therapy accurately. Additional assessments such as bone age determination, laboratory tests, and imaging studies may also be performed to monitor treatment response. Evaluating treatment response involves considering growth velocity, predicted adult height, height SDS, standard deviation score, and other relevant factors. Close collaboration between the endocrinologist, patient, and caregivers is necessary to ensure proper monitoring and adjustment of treatment plans. Long-term outcomes of growth hormone therapy are continually under investigation. Several studies have demonstrated that early initiation and adherence to therapy can improve final adult height in children with growth hormone deficiency. However, potential risks and safety considerations such as insulin resistance, glucose intolerance, growth of pre-existing tumors, and psychological effects should be carefully monitored and managed. Extensive research and ongoing surveillance programs help ensure the safety and efficacy of growth hormone therapy on a long-term basis. Growth hormone therapy has proven to be beneficial for children with certain genetic syndromes associated with short stature. Some of these syndromes include Turner syndrome, Noonan syndrome, Schacht's haploinsufficiency, and certain forms of skeletal dysplasia. By implementing growth hormone therapy, these children can achieve improved height outcomes and better quality of life. In addition to growth hormone deficiency, growth hormone therapy may also be indicated in non-GHD pediatric conditions with growth failure. These conditions may include chronic renal insufficiency, small for gestational age, SGA, with failure to catch up growth, and idiopathic short stature with no identifiable cause. The appropriateness of growth hormone therapy in these cases should be carefully evaluated by an endocrinologist. Timing and duration of growth hormone therapy greatly influence treatment outcomes. It is crucial to initiate therapy at an early stage to maximize the potential growth response. The optimal duration of therapy varies depending on the underlying condition and treatment goals. Close monitoring and re-evaluation at regular intervals help determine the appropriate duration of growth hormone therapy in each individual case. Understanding the pharmacokinetics and pharmacodynamics of exogenous growth hormone is essential for optimizing therapy. Growth hormone exhibits complex interactions with growth hormone receptors and binding proteins, which influence its distribution, metabolism, and elimination from the body. The half-life of exogenous growth hormone varies depending on the specific formulation used. Pharmacokinetic and pharmacodynamic considerations help guide dosing schedules and administration methods to ensure optimal treatment outcomes. Psychological factors and quality of life considerations play a significant role in the management of children on growth hormone therapy. It is essential to address any emotional, cognitive, or social challenges they may face due to their condition or therapy. Regular communication with the patients and their families can foster trust, support, and an overall positive treatment experience. As children with growth hormone deficiency enter adulthood, the focus of therapy shifts from promoting linear growth to addressing other aspects of endocrine health. Transitioning from childhood growth hormone therapy to adult replacement therapy involves careful evaluation of overall hormonal status, bone health, reproductive function, and metabolic profile. A collaborative approach between pediatric and adult endocrinologists ensures a seamless transition and continuity of care. In conclusion, the intricate world of endocrinology encompasses various aspects of pituitary physiology, growth hormone deficiency, indications for growth hormone therapy, treatment protocols, monitoring and evaluating treatment response, safety considerations, psychological impact, and transitioning to adulthood. Understanding these topics is essential for providing comprehensive care to patients with endocrine disorders. We hope that this detailed script has equipped you with a solid understanding of the complex field of endocrinology. Remember, knowledge is the key to making a positive impact on patients' lives. Stay curious, keep learning, and continue to explore the fascinating realm of endocrinology.